Good day, folks. Thank you for joining us here at Your Health. On today's program, we're going to talk about the omega-3 fatty acids. Now, what I did for this program is I sat down with the internet and the computer connections that we have to the medical libraries all around the world, and I reviewed the last 100 double-blind, placebo-controlled trials on the health benefits of the omega-3 fatty acids. And we're going to share those results with you. This is the truth about omega-3s. In recent months and years, some people have released negative studies on the omega-3s, but this shows overwhelming evidence of omega-3's benefits. Know the truth. We at least need to know the truth, don't we? But that's what we're pursuing on this program. Stay tuned for the health benefits of omega-3. First, let's go to our news. Let's see what's happening in the health world. Repetitive head impacts, as occurs in football, may lead to permanent brain damage. New research from the University of New Hampshire may have discovered a way to reduce football-related impacts and therefore preserve the health and brain power of athletes. The researchers placed impact sensors behind the ear on 50 NCAA Division I college football players during practice over an entire football season. The impact sensors monitored the frequency, location, and acceleration of all head impacts. One half of the players conducted typical football drills while wearing no shoulder pads or helmets. This group also conducted their drills at 50 to 75% pace. The other group practiced in full drills and full uniform as usual. They found the group that practiced without shoulder pads or helmets experienced 30% fewer head impacts during the course of the football season. The researchers comment, helmetless drills could make it safer to play football. The study was published by the Journal of Athletic Training. Well, this is truly good news. From the first study of its kind, when football players practice at 50 to 75% of their normal pace without helmets, it reduces the occurrence of significant head impacts by about 30%. Well, folks, now we're making progress. This study from the University of New Hampshire found the typical high school and college football player receives around 1,000 head impacts every year they practice for and play football. 1,000. It is no wonder so many retired professional football players display the symptoms of traumatic encephalopathy, or what we used to call dementia pugilistica, or being punch drunk. Well, this is just the first step of many more to follow. We also need improved helmets, along with a nutritional plan that provides athletes with all the nutrients needed to heal from head trauma. We already know a lot about nutritional therapies for head trauma. Helpful agents include the omega-3s, the B vitamins, including B12, magnesium, along with curcumin and grapeseed extract. But perhaps the most important nutrient to protect the brain is, of course, vitamin D. If you have a student athlete who loves to play football or some other contact sport, don't wait to get them started on this nutritional plan. It could spare them great suffering in the years ahead. Harmful food poisoning bacteria may survive for months in dry foods. In recent months, there have been several outbreaks of foodborne illness associated with packaged dry foods like cracker and cookie sandwiches. Researchers from the University of Georgia wanted to know just how long salmonella could survive in dry foods like crackers. They found cookie sandwiches made with chocolate or vanilla centers provided salmonella with the best environment for long-term survival, up to 6 months. Folks, traditionally meats have been the source of foodborne illness, or food poisoning as they were once called. Then in recent years, raw salad greens became the #1 source of foodborne illness, and now we have the emergence of dry, prepackaged cookie and cracker sandwiches with soft centers as the cause of recent food poisoning outbreaks. We should not be surprised, as just about any food can be contaminated. However, it is surprising that salmonella can survive in these sandwich crackers and cookies and still make us sick for 6 months and maybe even longer. Now, it's my impression that we will experience more and more food poisonings as time goes by. Why? Well, we have more people than ever. More foods are prepared, then consumed hundreds of miles away, and we have more super germs resistant to antibiotics than we've ever had. These problems are also reasons for keeping the immune system as strong as possible in order to resist these potentially deadly pathogens. Chronic pain suppresses the immune system. Researchers from McGill University evaluated the effect of chronic pain on the immune system of laboratory animals. They found with pain lasting longer than 6 months, there was an epigenetic effect on anywhere from 100 to over 1,000 different genes. Genes affected included those that control T cell production and modulate inflammation. The researchers comment that the genetic changes induced by chronic pain help to explain chronic pain's eventual association with life-threatening disease. Well, folks, I think every one of us have known someone who lived for a prolonged period of time in pain. Then after time, these unfortunate souls developed a serious illness like cancer or heart disease. We have all observed this phenomena, but scientists have not been able to explain why or how chronic pain leads to immune suppression and the emergence of life-threatening disease until now. Chronic pain causes an unfolding or folding of histone protein coats via methylation that either turns on genes of disease or turns off genes of wellness. This in turn has a profound impact on our immune system, opening the door to life-threatening disease. In the past, we've called this the health-eroding effect of chronic stress created by ongoing pain, but now we know exactly how it works, through genetic manipulation. What this means to us is we now have a way to help prevent the life-threatening diseases associated with chronic pain. First, we must get people out of pain whenever possible, and second, we should take higher levels of gene-protecting agents like the vitamins B, C, and D, along with minerals and trace minerals. It may take a while, but I assure you, better therapies for chronic pain and life-threatening disease will emerge as a result of this breakthrough study. Well, today on Your Health, we'd like to discuss the health-promoting properties of omega-3 fatty acids. Stay tuned to learn more. You may have heard the saying, an ounce of prevention is worth a pound of cure. It's true. I'm Dr. Richard Becker.
And I'm Cindy Becker. Autumn is a time of transition. It's the perfect time to renew your dedication to healthy living. This September, we're excited to bring you our fall savings celebration here at Bioinnovations.
Perhaps you've heard about the health benefits of supplements. In many cases, they can make a big difference.
During September, Dr. Becker Spa Nutrients are up to 40% off. Noni Natural Skincare and Spa Therapy are 40% off. And Aloha Noni and Acai are still 50% off by the case. And you get free shipping with orders over $50 in the continental U.S.
This is a good time to restart a program of nutrition, exercise, and supplements because an ounce of prevention really is worth a pound of cure.
Order online or call 888-442-2128 and let Bioinnovations assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
I'm Cindy Becker for Your Health at a Glance. We all have said, I need to get some exercise, but how many of us put on our walking shoes and go? Learning a little more about the health benefits of exercise may help you get motivated to lace up those walking shoes. Exercise helps to control our appetite and weight. It maintains strong muscles. It promotes the release of endorphins that counter depression while helping us feel good about our lives. Exercise helps to lower blood glucose, promotes a strong circulatory system, and controls cholesterol. Exercise even helps us get a good night's sleep. Recent research finds dog owners who regularly walk their pet are 34% more likely to achieve fitness goals. You can get all of these health benefits by walking 30 minutes 4 times a week, just 30 minutes a day. Start today, and you'll start to get all those benefits. For Your Health at a Glance, I'm Cindy Becker.
Is your life out of balance? It may be. The average American consumes far too many omega-6s and not enough omega-3s. This creates an imbalance.
So what can we do to get back in balance? We can eat a healthy diet.
And most of us need to supplement with omega-3 rich fish oil. Fish oil contains omega-3s with DHA and EPA, fatty acids that promote good brain and heart health. So reduce omega-6 in your nutritional plan and boost omega-3 to get back in balance.
To help you do that, Bioinnovations offers 2 products, the Fish Oil Complex and Omega-369, both formulated for your health and well-being. So how do you choose? For highest levels of DHA and EPA, choose the Fish Oil Complex. For a balanced formula, choose the 369.
Go online at bioinnovations.net or call 888-442-2128. Ask about the AutoShip program for additional savings.
Welcome back, everyone. It is truly a blessing to be with you today, and I hope everything is wonderful in your corner of the world. Well, sit back and enjoy. Today's show is going to be amazing. We're going to learn together the importance of including the omega-3s in your diet. And this means not only in your supplement plan, but in your diet as well. It's just amazing the things that the omegas offer you for total health. You know, Richard, recently I ran out. I mean, I have a whole warehouse full of omegas, and I ran out at home.
Yes.
And I just didn't take the time to go get myself a supply. And I tell you, that's one of those things that when you are supplementing routinely with the omegas, maybe you don't really feel it. You just know that you feel good. But when you stop and you run out and you don't keep supplementing, then it is apparent.
Yes.
I hope everyone really learns that today, what it can do for you.
Well, that's a good point, because our nutrients provide us nutrients for normalcy. It's just a normal day. When we're deficient, you have an abnormal day. And sometimes people think when we take these nutrients, it creates a drug effect. And that's not how this is. We're setting the stage so that you can be what you are capable of being.
Right.
And when you miss it a few days, you notice. You notice. Right. And maybe that's a good idea every now and then to remind ourselves, yes, this is important, let's keep going with it. We hear so much about the omega-3s, folks, and we take a lot for granted when we talk about the omega-3s, so let's give you a little background. For many, many years, it has been assumed that there are two essential omega-3 fatty acids. These are the oils in our diet. Alpha-linolenic acid was thought to be the only essential omega-3, alpha-linolenic acid. Then we have linoleic acid. That is what was thought to be the essential omega-6. Now, with our omega-3, alpha-linoleic, this substance is less common in vegetables, but it is there. Avocado has a little, flaxseed has quite a bit of it in it. Less common in vegetables, but very common in commercial meats and pasture-raised meats. Pasture-raised meats have significantly more than feedlot-raised meats, but alpha-linolenic acid is found in beef fat. Let's just make it simple so we all understand that. Now, linoleic acid is very common in vegetables: soybean oil, corn oil, safflower oil. It's also fairly common in beef fat. We have less of that omega-6 in pasture-raised beef fat, but nonetheless, it's still present. Now, it has always been assumed that this essential alpha-linolenic acid, the omega-3, the one essential omega-3, is then converted to EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid, which are so important for the heart and the brain, the vascular system, our joints, and all these benefits. Vegetables and most land-based meats, all of them, as a matter of fact, do not contain these. Where we find the EPA and DHA is in marine-based animals. Marine-based animals. We have always, people who live in the middle of the country and never eat seafood like salmon, they have to convert their alpha-linolenic acid into these essential omegas, DHA and EPA. Now, I hope that makes sense to you, because it all plays together, and you don't have to really understand this, but understanding leads to enrichment. And I think you'll get my point as we go along with this. Now, the next step, are you getting enough omega-3s? What happens to us when we do not get enough omega-3s? So we've developed a little quiz. As we go through these conditions, give yourself a point every time you're afflicted by this condition. And I want to tell you, I personally have met a person with every one of these conditions who have responded remarkably well to supplementation with omega-3s. Dry, itchy skin. This is particularly a problem in the winter. That can just be from really dry skin, but if your skin does not dry out so bad when you're rich in the omega-3s. If you have dry, itchy skin, we particularly notice this in the winter, give yourself a point. Brittle hair or brittle nails. They flake and break easily. The hair breaks easily. Wounds take a long time to heal. Cuts, bruises, scrapes, takes longer to heal than they used to. Clotting issues, and it really can be of any type. Mostly, you're more likely to clot. More likely to clot. Muscle loss. You just don't feel the strength. don't feel the strength. Do you have high blood pressure? This is a very common problem in our country today, high blood pressure. Give yourself a point. High triglycerides, or you've been told you're pre-diabetic. Do you have cardiac arrhythmias? Irregular heartbeats, irregular heartbeats. Poor circulation. If you've been told you have poor circulation, or your hands or feet get cold very easily, or dusky blue, you think, oh, I just don't have good circulation. Do you have a family history of cardiovascular disease? Families share genes. We also share lifestyle traits. It may have nothing to do with your genetic makeup. It may be something your family does in particular that leaves you low in omega-3s. Do you have a history of heart attack? Do you have a history of a mini stroke or a transient ischemic attack, a TIA? Do you have ADHD, or does your child have ADHD, or inability to concentrate? We're seeing a lot of adults now with ADHD. A lot of this is just a deficiency in omega-3s. Chronic depression, or even intermittent depression, or episodic depression. Anxiety and irritability. If you're low in omega-3s, everything will stress you. Short fuse. Fatigue, stress, susceptibility to stress. Now, we all have fatigue and stress in our lives, but it's a problem. It's an ongoing problem. I don't know what to do about this kind of problem. Worsening or changing of your eyesight. Do you crave fatty foods? This is one of the very first symptoms of being low in omega-3 is, I want something fatty. And when that happens to us, what do we reach for? Salty, fatty chips. There's no omega-3s in those salty, fatty chips. So we eat to excess, and we tend to gain weight when we're low in omega-3s. We never really get what our body's seeking. See, that's the problem. We got to eat the right kinds of foods. Constipation, bowel irregularity, constipation, low fertility, particularly in men, more so in men than women, but it can happen to any of us. Low fertility, joint pain, this is a common one, weak bones, osteoporosis, inflamed bones, everything aches. Chronic inflammatory conditions, they usually end in itis like arthritis, bronchitis, colitis. You stay inflamed. The omega-3s feed the calming enzymes that calm down inflammation. And do 50% or more of your meals come from outside of your home, fast foods, restaurants, pre-prepared foods. This is a classic history of those low in omega-3s. Well, that's our quiz. Add up your marks. How'd you do? How'd you do? You willing to tell me?
Well, I did good because
Yes.
I've been on my fish oil
Yes,
for a
you
while.
have. So you did good. All right. If you have 1 to 2 points, low likelihood of omega deficiency. Probably not. It could be, though. Probably not. 3 to 5 points, medium likelihood, you require some changes. We need to eat a little better. We need to do better in what we're doing. 6 or more, it's highly probable that you are deficient in the omega-3s. And the only thing that will calm these symptoms is the nutrient you're missing, and it is most probably omega-3s. Most doctors in today's world do not do tests to ascertain if you're low in omega-3s, but they can be done. Holistic physicians know how to do this, and I'd recommend if you scored high in this, find out, or just start supplementing your omega-3s. They're not toxic. They're not drugs. They're safe for everyone. Now, we said the old approach to this was alpha-linolenic, the omega-3 essential. Linoleic acid is the essential omega-6 that we convert to all others. But what we're finding is, even if you're getting that alpha-linolenic, the essential 3, you may be a poor converter to EPA and DHA. Poor converter. It requires enzymes to do that, and many people do not have a good representation of those enzymes. Modern advanced techniques show that ALA, or linolenic acid, is only marginally converted to EPA and onto DHA. Radioisotope labeling, specialized laboratory techniques, shows that most people have an overall 0.4% efficiency. 0.4, very inefficient converting from ALA to EPA and DHA. Very poor converter. And on to DHA is at 0.1%. Now, men are more likely to be poor converters, women less likely, but still anyone can be poor converters. This is why we say flaxseed oil is a good omega-3, but you may not be able to convert it to EPA and onto DHA. Some people absolutely must have the fish oil or the marine-based omega-3s, EPA and DHA, in order for optimal health. Now, I hope you understand the scenario a little better. It makes sense for you. When we return, let's go to the modern studies on the benefits of fish oil. We'll be back. You may have heard the saying, an ounce of prevention is worth a pound of cure. It's true. I'm Dr. Richard Becker.
And I'm Cindy Becker. Autumn is a time of transition. It's the perfect time to renew your dedication to healthy living. This September, we're excited to bring you our fall savings celebration here at BioInnovations.
Perhaps you've heard about the health benefits of supplements. In many cases, they can make a big difference.
During September, Dr. Becker's Spa Nutrients are up to 40% off. Noni Natural Skincare and Spa Therapy are 40% off. And Aloha Noni and Acai are still 50% off by the case. And you get free shipping with orders over $50 in the continental U.S.
This is a good time to restart a program of nutrition, exercise, and supplements because an ounce of prevention really is worth a pound of cure.
Order online or call 888-442-2128 and let BioInnovations assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
I'm Dr. Richard Becker for Your Health at a Glance. More and more people suffer from asthma. One cause is obvious. The world is a polluted place, and the air we breathe is not always healthy. But other causes of asthma aren't as obvious. Recent research connects a poor quality, high sugar diet and the frequent use of antibiotics to higher rates of asthma and cases of asthma that are tougher to treat. A fast food diet does not meet our nutritional needs. Plus, the indiscriminate use of antibiotics can seriously disturb the delicate balance of healthy microbes in our intestinal tract. So switch to a garden fresh diet that calms and prevents asthma. Eat fruit-like veggies such as tomatoes, cucumbers, and eggplant. Eat yogurt, ginger, turmeric, and take fish oil. Nature holds the answer, but it's up to us to make healthy choices. For Your Health at a Glance, I'm Dr. Richard Becker. Every day, about 200 million Americans do not get enough of a key essential mineral.
That mineral is magnesium. The typical American diet does not supply enough.
And magnesium is so important. It protects bones and helps more than 300 different enzymes in the human body perform efficiently.
That's why BioInnovations offers chelated magnesium capsules for oral use and topical magnesium gel to be applied to the skin. That's 2 forms of magnesium to meet your daily needs.
Scientific evidence points to chelation as the best method of vitamin and mineral formulation.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health.
Because chances are you are one of the 200 million Americans who need more magnesium every day.
Again, that number is 888-442-2128. Call today. Ask about the AutoShip program for additional savings.
We're back, everyone, having an interesting discussion on the importance of omegas in our diet. This is just really important and interesting information. Now, Richard has some new studies to share with you. These are kind of long, but they're really interesting, and they're most current science out there. That's what's really great, Richard, because you know, I think the omegas have been well studied, of course, over the years, and I mean, many, many years, but science marches on and they're keeping up with it. That's what's great.
And I want to make clear a very important point. If you go to the common encyclopedia websites where you can learn about various science things, you will often, these are websites that people can go in and change the information. And that's a good thing, and it has bad things too. And one of the problems with that is it's easy to manipulate the data to misrepresent something. And you will see reports of studies conducted by lofty individuals from ivory towers with big credentials that disprove the health benefits of omega-3s. No benefit from death risk, no reduced death risk from heart attack, no reduced risk from cancer, it causes prostate cancer, all these things. Okay, they're counting on the fact that you do not want to go into the depth of finding out what the other 100 double-blind placebo-controlled trials actually show. And if you ferret out who paid for these studies, they're almost always paid by a pharmaceutical company in direct competition with the omega-3s. What they want you to do, folks, is to discount natural therapies and become dependent on them for your health care. And that is disingenuous, and it's not the truth. Now, if you don't want to know the truth, turn off this program. If you want to know the truth about omega-3, stick with me. Make your own conclusions. Here are the results of the last double-blind, 100 placebo-controlled trials. Double-blind, highest level of confidence. Here we go. Omega-3s and cardiovascular disease. Omega-3s, each one of these little sound bites was a result of a very large clinical trial. Omega-3s reduce triglycerides. That reduces heart disease in and of itself and stroke, reduces sudden death risk. It delays cardiovascular death. It reduces heart attack risk. It reduces plasma viscosity and red blood cell rigidity. That allows the blood to go into the circulation, into the tiny little arteries and capillaries better. It lowers systolic blood pressure, thereby reducing blood clot risk. Blood clots are the essence of half the deaths in America today. It improves heart rate variability at rest. The heart is more adaptable. It can respond quicker to whatever need. Heart rate variability is a sign of good health. It improves that. It improves heart rate variability during stress tests by improved autonomic nervous system control of the blood, of the heart. You don't have to think about your heart rate for it to respond, do you? It's done automatically through the nervous system, but if you're low in omega-3s, that doesn't work real well, and you're susceptible to arrhythmias. See, makes sense. And they've proven less arrhythmias when you take omega-3s. Reduces the risk of heart attack after stent placement. You know what I mean? When they open up the vessel, reduce risk of heart attack after that in high-risk patients, and they define the mechanism. It improves angina in cardiac syndrome X. What is that? There's no lesion in the coronary artery, there's no narrowing of the artery, but they still have angina and heart attacks. Syndrome X, we can't explain it. Well, they have explained it. Omega-3s reduce the risk of angina, reduces angina in Syndrome X. If you've had it, you've heard of this. They've proven that it improves the blood flow in Syndrome X and reduces oxidative stress. They know how it works. Lessens the risk of stress-induced heart attack. Many authorities believe you can't have a heart attack unless you are under stress. It's an essential component in the vast majority of heart attacks. Omega-3s reduce that. Mechanism defined. EPA reduces blood clots in men. DHA reduces blood clots in women. Less clots, less heart attacks. Add it up. It just makes sense, doesn't it? It reduces platelet aggregation. These are the little snowflakes in the bloodstream that clot off trauma. Broken blood vessels helps to seal those off. We don't want those to aggregate, to clump up when there is no trauma. You block a blood vessel without trauma, you're going to have a problem. That's called an emboli then. Thrombus emboli. Reduces markers of inflammation known to predict high risk of sudden death, known to cause MI, improves endothelial dysfunction in smokers, arteries perform better in smokers, improves cognitive performance, reduces, well, you know, if you're a heart patient and you're thinking clear, you figure out things better. It applies to cardiovascular disease. Cognitive performance applies to cardiovascular disease. Reduces the risk for cardiovascular disease in diabetics, even seniors, even elderly diabetics have less risk of heart attack. Improves heart rate variability in chronic heart failure, better control of the heart. Autonomic system controls it better when you're on your omega-3s in heart failure. Review of double-blind evidence, omega reduces the risk of fatal coronary heart artery disease and sudden cardiac death. That's an objective review, not the one paid for by the drug company. Reduces cytokines and markers of oxidative stress while they lengthen white blood cell telomeres. In other words, your immune system produces white blood cells that live longer and are better effective at fighting infections and disease. There is a germ connection to heart disease. You know, bad teeth leads to heart disease. You fight those germs off, you're at less risk. White blood cells live longer when you take omega-3s. Isn't that amazing? Reduced risk of atrial fib after cardioversion. Your normal rhythm holds better if you're on omega-3s. So many of our viewers have atrial fib or on warfarin. We want to stay out of that stuff. It's such a risk to us. If vitamin E and C are added to the omega-3s, it reduces post-op risk of atrial fib. You know, the stress of an operation can induce the AFib. If you're on the omega-3s, you're less likely to do that after an operation. Long-term use improves gene expression of anti-inflammatory pathways. You'll need less Advil. Less Advil means less risk of heart disease, because all of these anti-inflammatories increase our risk of heart disease. That's a problem. In post-heart attack patients not on statins, reduces the risk of second heart attack. So if you're less likely to have a second heart attack, you're less likely to die. Doesn't this make sense to you? Of course. Large trial reported on the evening news, sponsored by the drug company. 12,000 patients from across Italy, omega-3s versus olive oil. Olive oil, it was used as the placebo, versus omega-3s. They both reduce heart disease. We're doing a trial in people who followed the Mediterranean diet, eat a lot of fish and olive oil, and 1 gram of fish oil didn't reduce the risk of death. That's baloney. They set it up to fail. Now, you heard the latest. What do you think? There's no doubt in my mind. The omega-3s reduce the risk of death, they reduce heart attacks, and they reduce the risk of death from a heart attack. You can count on that. We'll be right back with more. You may have heard the saying, an ounce of prevention is worth a pound of cure. It's true. I'm Dr. Richard Becker.
And I'm Cindy Becker. Autumn is a time of transition. It's the perfect time to renew your dedication to healthy living. This September, we're excited to bring you our fall savings celebration here at BioInnovations.
Perhaps you've heard about the health benefits of supplements. In many cases, they can make a big difference.
During September, Dr. Becker's Spa Nutrients are up to 40% off. Noni Natural Skincare and Spa Therapy are 40% off. And Aloha Noni and Acai are still 50% off by the case. And you get free shipping with orders over $50 in the continental U.S.
This is a good time to restart a program of nutrition, exercise, and supplements, because an ounce of prevention really is worth a pound of cure.
Order online or call 888-442-2128 and let BioInnovations assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
I'm Dr. Becker with Your Health at a Glance. Have you or someone you love recently been diagnosed with cancer? It is projected by the year 2020, some 18 million Americans will be cancer survivors. The main reason for this upward trend is our treatments for cancer are better than ever. Our cancer medicines are much improved, and we know more about how cancer works. In addition, holistic principles of cancer care are becoming standard of care treatment. Plus, research centers are discovering natural substances with true benefits for the cancer patient. This is an age of wonder, as we can incorporate both mainstream medicine and the fields of complementary and anti-aging medicine into your plan to beat cancer. I'm a cancer survivor who's here to tell you that you have more tools than ever in your battle with cancer. For Your Health at a Glance, I'm Dr. Richard Becker. CoQ10 and L-carnitine are among the most important nutrients our bodies use for energy production. Deficiency in these key nutrients can cause serious complications to your health. In fact, statin drugs that are used to lower cholesterol may deplete your CoQ10 levels.
BioInnovations brings you Dr. Becker's Bionutrients CoQ10 with L-carnitine. Now, providing support for cardiovascular health is easier than ever before.
CoQ10 and L-carnitine support a healthy heart naturally, as nature intended, and our formulation provides 300% greater absorption of CoQ10 than similar products, using a technology so effective it's patented.
BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net.
We're back, everyone. Isn't this interesting information on the omega-3s? Well, before we continue, I want to let you know it is fall savings celebration at BioInnovations. Great prices, best prices of the season, and free shipping on your orders over $50. Of course, that's the mainland USA, but good time to get those omegas for your total good health. So, Richard, that was a lot of the cardiovascular studies, but it was amazing. And, you know, the whole cardiovascular system isn't just one organ. I mean, that's a whole big system.
It's our entire body.
Right.
Everything.
So all of these studies, I mean, they sound alike.
Every blood vessel throughout the body.
Yes, it's amazing.
It really is. So we just did the cardiovascular disease and about 40 studies from the last 100, but we have other areas of benefit for the omega-3s. The next area is the brain, neurology, psychology, mentation, mood. The brain and nervous system. Make sense? Okay. What are the benefits of the omega-3s? And I'm talking specifically about the marine versions. If you are a proper converter and you can do the alpha-linolenic onto EPA and DHA, you're fine. But it's hard to know who that is, and it is a small minority that does that efficiently. Not everybody does. Most of us need to rely on the marine-based EPA and DHA. I'm hoping I'm making this clear. Understanding is the key of everything. But for your lack of knowledge shall you perish. It's in the book, folks. We need to know more about our own health. Here we go, neuropsych and the omegas. The omega-3s, the marine-based, improve psychosocial behavior in adolescence. Isn't it a joy to be around a well-behaved young person? But when you have a combative, resistant, fighting young person, what is wrong? Where is the spirit in this child? We can improve this with omega-3 therapies. It is miraculous to see when you see it, folks. So if you know anybody who has a struggling teenager, they're difficult at school, they're combative and resistant to any type of authority of, this is good for you, son, why don't you want to do that? You know what I'm talking about. We've all experienced that. It's very helpful. And especially if they have a borderline personality. You know, there are cases, and it happens every day in this country, where a child, a young person, a teenager, is labeled with a mental illness, a personality disorder, when they really just need omega-3s. That's what I'm trying to tell you. Don't let that happen to your loved ones. Omega-3 fish oils. It reduces the risk of psychosis, personality disorders, and behaviors and combative behaviors in adolescence. In young patients at risk of psychosis, it reduces the occurrence and progression to psychosis with less negativity and fewer psychiatric symptoms overall, while they improve their response to antipsychotic and antidepressant medicines if they need them. Many will not need them, but if they do, they're going to respond better with the omega-3s. And this also applies to adults, I assure you. But in the young developmental age, when the brain is growing, that's when they need really high doses to be all they can be. Make sense? I hope so. Reduces the biomarkers known to represent the presence of beta amyloid in Alzheimer's disease. Laboratory evidence of progression of amyloid in Alzheimer's is reduced with omega-3s. It slows the progression of Alzheimer's disease, and this study proved how it does it. Improves memory and reaction time in healthy young adults who eat a poor diet. Fast Food Nation, pay attention. Improved reaction time, improved memory, that's better job performance, more pay raises. Everything works better when the brain is sharp. Improved depression scores in depressed senior women. Improved short-term and working memory. And everybody, immediate verbal memory and delayed recall capabilities in seniors with mild cognitive impairment, the early stages. When grandmother's beginning to lose the memory, where are the keys, this type of thing. You know what I'm talking. We can improve that with fish oils. Improves ADHD, attention deficit hyperactivity disorder scores in kids and adolescents. EPA provides greater improvement in depression scores, improves reading skills and behavior in underperforming kids. Over time, EPA DHA improves Ritalin's effect in kids if they need these medicines, and those who fail to respond to Ritalin may now respond to it if they're taking fish oil supplementation. Now let's switch gears. Obesity and diabetes. Are the omega-3 something that can help them? The latest research on this category. The omegas, higher dose omegas, 7 grams a day, and that is not, imagine the Inuit natives, Eskimos, as it were, the northern people, they eat 10s and 20s and 30s, 50 grams of fish oil a day. It's their major source of fuel energy, are the marine-based seal blubber, fish oils. I mean, this is common. 7 grams is nothing to them. That's a snack. It's not dangerous or high, but it is higher for the way we think of things. I hope I make that clear. Dr. Sinatra told me he takes 15 grams every day and he eats fish 4 or 5 times a week. It's safe to do that. He's a cardiologist. He should know. These should know. Improves weight loss and measure of inflammation in obese adults on a weight loss diet. You're going to lose weight better because it helps with dietary satisfaction. Reduces superoxide free radicals in diabetes type 2. The cause of the damage from high blood sugars, it helps to negate that. Reduces overall inflammation in the diabetic. Reduces inflammation in sedentary, overweight, middle-aged, and up adults. Achy joints, finding you're sitting in the couch far too much, they hurt too much, get on the omega-3s. Develop a plan and get up and get moving. It's going to get better. Reduces ventricular arrhythmias. These are the ones that are very deadly after a heart attack in the diabetic. Obstetrics and gynecology benefits next before the break. Decreases PMS scores by decreasing depression. Young ladies in tough periods, it's so tough for them. Get on a plan. The omega-3s, some magnesium, some B vitamins, maybe a little progesterone, a little curcumin, vitamin D. Get on a plan. We can get those periods better, get you back into the flow of things. It's going to help you so much. Nervousness, anxiety is decreased. Lack of concentration is improved. Bloating, headache, and overall pain and effect in dysmenorrhea improves with time. It's not overnight. Takes a little time for the cycles to correct. Lessens the need for pain medication in dysmenorrhea. Improves insulin sensitivity, lipid profiles in polycystic ovarian syndrome. PCOS, Stein-Leventhal, it will improve it. So will vitamin D. Decreases insulin levels. Glucose levels improve in diabetes. Insulin resistance improves. DHA given to mother improves fetal heart rate variability and newborn neural behavior. DHA is an essential nutrient to the newborn. They develop seizures and death if they are deprived of DHA completely. Has to be in formulas if you're not breastfeeding. Be sure of it. A couple more here and we'll go to the break. DHA supplementation during the last half of pregnancy leads to longer gestation, which is a good thing, and larger baby size. No preemies, as we used to call them. Maternal DHA supplementation leads to improved infant sleep better on. You know, that early first 2-3 months when baby won't sleep, we can help that by supplementing. In senior and elderly women, DHA EPA improves walking speed while it decreases frailty. Let's go to the break. When we return, we have urology, nephrology, and some various effects of the omega-3s. We'll be right back. Is your life out of balance? It may be. The average American consumes far too many omega-6s and not enough omega-3s. This creates an imbalance.
So what can we do to get back in balance? We can eat a healthy diet.
And most of us need to supplement with omega-3 rich fish oil. Fish oil contains omega-3s with DHA and EPA, fatty acids that promote good brain and heart health. So reduce omega-6 in your nutritional plan and boost omega-3 to get back in balance.
To help you do that, BioInnovations offers 2 products, the Fish Oil Complex and Omega-369, both formulated for your health and well-being. So how do you choose? For highest levels of DHA and EPA, choose the Fish Oil Complex. For a balanced formula, choose the 369.
Go online at bioinnovations.net or call 888-442-2128. Ask about the AutoShip program for additional savings.
Here is our hope for you today. I'm Cindy Becker. When we struggle with disease and painful health conditions, we can become overwhelmed with negative thoughts. We may even develop depression. The Apostle Paul offered guidelines to help us preserve a positive attitude during times of trouble. He wrote in Philippians 4, verse 8, "Whatever is true, whatever is noble, whatever is right, whatever is admirable, if anything is excellent or praiseworthy, think about such things." Thinking positive thoughts is the first step toward overcoming worry, even depression. Proverbs 17, verse 22 reminds us, "A cheerful heart is good medicine, but a crushed spirit dries up the bones." Remember these words of wisdom as you face your health challenges. I'm Cindy Becker. This is our hope for you today.
You may have heard the saying, an ounce of prevention is worth a pound of cure. It's true. I'm Dr. Richard Becker.
And I'm Cindy Becker. Autumn is a time of transition. It's the perfect time to renew your dedication to healthy living. This September, we're excited to bring you our fall savings celebration here at Bioinnovations.
Perhaps you've heard about the health benefits of supplements. In many cases, they can make a big difference.
During September, Dr. Becker's Bionutrients are up to 40% off. Noni Natural Skincare and Spa Therapy are 40% off. And Aloha Noni and Acai are still 50% off by the case. And you get free shipping with orders over $50 in the continental U.S.
This is a good time to restart a program of nutrition, exercise, and supplements because an ounce of prevention really is worth a pound of cure.
Order online or call 888-442-2128 and let Bioinnovations assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
We're back, everyone, discussing the importance of the omega-3s in your nutritional plan and in your diet. This is just amazing, and I've got to let you know it is Fall Savings Celebration at Bioinnovations, a good time to get the omegas as well as all the other nutrients you need for a healthy season. Best prices and free shipping on orders over $50 in the mainland USA, so don't miss it. Richard, you have a few more studies. This is really interesting.
Urology, nephrology, or kidney and urinary tract problems, and the omega-3s. The omega-3s reduce PSA levels in healthy men, and it does not cause prostate cancer. That's another red herring out there to distract. If it caused prostate cancer, the Inuit and the northern people would have the highest rates of prostate cancer in the world. But they do not. In fact, studies that have followed the indigenous people of the North, most years there's not even one case of prostate cancer reported. Now, if it caused all this prostate cancer, how in the world would the natives of the North pull that one off? Think about it. I'm not falling for that. What else? It reduces the inflammation in chronic kidney disease. If you're on dialysis, taking a little omega-3s helps to calm that nephron down so it can still do a little more of its work. It's a very important part of managing chronic kidney disease. Get Dr. Rich Snyder's book and read all about it. He talks about the omega-3s in dialysis patients. Very important. Various effects of the omega-3s. Sickle cell disease. It reduces vaso-occlusive events. Sickle crisis. It reduces the sickle crisis. It reduces a severe anemia and need for blood transfusion in sickle disease. It improves white blood cell count while it improves school attendance. Isn't that amazing? Next subject, reduces Taxol-induced sensory nerve neuropathy in breast cancer chemotherapy. Helps you tolerate breast cancer chemotherapy better. Less nerve problems. Reduces inflammation of the lung and the asthma by modulating oxylipins and mediators of inflammation. 87 different molecules studied in this study, and they gave the whole cascade of inflammatory events and how omega-3s calm the inflammation of asthma. An amazing study, and everyone should benefit from this. Had nothing to do with a drug, not one thing. Omegas with their if you take the omegas with the carotenoids, lutein, astaxanthin, you know, the carotenoids, we talk about those, improves end-stage age-related macular degeneration. Diabetics, pay attention. Reduces CRP levels. That is inflammation again. Improves the symptoms of Raynaud disease, the hot, cold spasm in the hands. Oh, it's a terrible thing. It's very painful. And if you ever met somebody who has it, you go, oh, I got to tell them it's going to help. And so does L-carnitine. L-carnitine helps that too. Cold tolerance, vasospasm, and pain. That's what that's all about. Reduces pain medication use in overweight rheumatic arthritis patients. That's the end of the 100 studies. Now, from past studies, this entire bank, thousands of research projects conducted around the world, we also know less PMS and dysmenorrhea, less risk of preeclampsia and preterm birth, improves birth weight, improves baby's IQ, improves high-end coordination, it improves eyesight and breast cancer risk in babies and mothers who took DHA. Isn't that amazing? If mother supplements, and a Harvard study found it's worth eating fish or supplementing DHA, EPA in pregnant mothers, the benefits exceed the risk of mercury toxicity if you're eating the right fish, and baby will have a higher IQ, baby will have better eye-hand coordination, and female babies will have a less breast cancer risk their whole life. Get your kids off to a good start. It pays off. Children have less allergy and asthma-related problems. Higher IQ, we said that. Autistic children, symptoms improve. A man called me and said, Dr. Becker, your plan for autism has changed my life and it's saved our marriage. Please do these things for the autistic children. Kids are less obese. Adults are less obese. Studies have proven this. Omega-3s. Children, adolescent adults have fewer psychiatric problems, including depression, attention deficit, bipolar depression, and schizophrenia. Mental illness. What are we doing? Popping psycho pills, one after another. We're treating symptoms, not the cause. Treat the cause. Responds better to medication, mental illness, reduces inflammation and risk of diabetes. That's all been done and redone many times. Improves glucose control in the diabetes, reduces the rate of cardiovascular disease, including less clots, lower blood pressure, less heart failure, heart attacks, and sudden cardiac death. It's all been established. Don't believe the hype on the news media. They're not there to help you. They're there to make you dependent on companies that advertise on their programs. You know, it just amazes me that people will do that with the lives of others. Does that not bother you? Am I all alone in that? How are they getting away with that? I don't like that. Lowers the rate of inflammatory bowel disease. If you do have inflammatory bowel disease, you have fewer episodes and less pain. It's not going to cure it necessarily, but it will help make it better. What else? Reduces cancer rates by up to 2/3, reduce cancer risk. Reduce the risk of Alzheimer's, slows the decline, Parkinson's disease, and other neurodegenerative diseases, lowers the risk of macular degeneration, lowers the rates of autoimmune disease, lowers the incidence of flare-ups of arthritis and whatnot, autoimmune arthritis, counters the effect of excitotoxins, prevents the progression of osteoarthritis, and don't forget, the Old Testament tells us what kind of fish to have. Fish with scale that are not bottom dwellers or scavengers. It is the foods that we may eat. Also, don't forget the miracle of the loaves and the fishes. Christ used fish, not chicken McNuggets. We have more when we return. You may have heard the saying, an ounce of prevention is worth a pound of cure. It's true. I'm Dr. Richard Becker.
And I'm Cindy Becker. Autumn is a time of transition. It's the perfect time to renew your dedication to healthy living. This September, we're excited to bring you our fall savings celebration here at BioInnovations.
Perhaps you've heard about the health benefits of supplements. In many cases, they can make a big difference.
During September, Dr. Becker's Spa Nutrients are up to 40% off. Noni Natural Skincare and Spa Therapy are 40% off. And Aloha Noni and Acai are still 50% off by the case. And you get free shipping with orders over $50 in the continental U.S.
This is a good time to restart a program of nutrition, exercise, and supplements because an ounce of prevention really is worth a pound of cure.
Order online or call 888-442-2128 and let BioInnovations assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
I'm Dr. Richard Becker for Your Health at a Glance. Do you have a family history of a certain disease? Scientists are discovering that our genetic code plays a smaller role than previously believed. Only about 20% of disease is tied to our innate genetic code. So what determines the other 80%? The answer may lie in the emerging field of epigenetics. What is it? Epigenetics is a group of changing factors responsible for both how our genes are read and how they are then applied throughout the rest of the body. And this may explain why identical twins with identical genes can have different health problems. Researchers believe two of the main factors in epigenetics are nutrition and environmental exposure to toxins. So eat a healthy diet, reduce toxin exposure, and you may improve your own epigenetics. For Your Health at a Glance, I'm Dr. Richard Becker.
Do you believe that nature holds the answer to your health needs? Are you looking for a supplement that's simple and pure, yet really works?
If you're looking for nature's answer to better health, look to Aloha Noni juice. It's pure and fresh, just like nature intended. Aloha Noni juice is brought to you direct from the islands of Polynesia.
Aloha Noni juice is 100% pure with no added sugar or sweet fruit fillers. It's the perfect addition to your low-sugar diet.
Aloha Noni juice drinkers will tell you their vitality, energy, and sense of well-being have improved, along with relief from many painful conditions. Made by nature, proven by science, Aloha Noni juice contains only nature's best.
And now you can enjoy the benefits of our new 100% certified organic Noni juice.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. Your Health is brought to you by BioInnovations, trusted products for your health and well-being.
We're back, everyone. Just a quick reminder, it is Fall Savings Celebration at BioInnovations. Don't miss it. So, Richard, what are the best sources to get these omegas?
Well, dietary sources are ocean fish and even some lake fish, like trout. That's a good source. But the point being, ocean fish that have short lives. You know, even the longest lived salmon, maybe 5-7 years. Whereas a shark or a swordfish may live 50, 100 years. We're not really quite sure how long they live, but some we know for sure can live many, many years. And the point of that is, over this long life, they accumulate and retain a lot of mercury, these large fish that live for many decades. So we want to talk about salmon, halibut, herring, sardines, tuna, mackerel, trout, cod. These fish turn over quickly in the food chain, and it's a better source for us. Better source. Avoid the fish high in mercury. These are fish like shark, swordfish, marlin, ray, gemfish, tilefish, and orange roughy. Anything that gets really big and lives a long time, we have to be careful. Folks, one of our recurring things on this program, I want everyone to understand how polluted this world is. Getting rid of a couple pesticides, DDT back in the day, did not solve the problem. We still have mercury in the environment, and we have to be aware of it because there's no amount of mercury that's safe. We really have the least amount available, okay? So when we extract the fish oils, we want them to be from short-lived fish as well. Now, plant sources, this is not the EPA and DHA, but the plant source, flaxseed oil is wonderful. Walnut oil is wonderful. This is for the vegans and vegetarians. Absolutely good sources, this type of thing. You know, canola oil is so processed today. Who knows what all they're doing to that canola oil? I'm with you guys now. I'm converted over. I try to avoid the canola oil and it as much as I can. You know, it's the pattern. It's our day-to-day 90-10 rule. 90% of the time we're very careful, so then when we travel, a special event, that little 10% doesn't bother us very much. If you're fighting for your life, it needs to be 100% for a while. To get you back on track, get your strength back up, then you can go back to the 90, 85, 10, 15 rule. You know what I'm saying? It's our daily patterns that count. Now, at BioInnovation, Cindy, you've provided so much for us, so many wonderful products. We have a variety of omega-3s. I really like the 3, 6, 9 to get you the balance back. You know, that's a really excellent idea. I love that one. And then the fish oil complex, and what's special about that one, we spike that DHA. We get it up there. We get a good high level to really help the brain. And it's so helpful. I tell you, it's amazing, this stuff. It was one of my favorite subjects in biochemistry while I was studying that. It's complicated, but not really. God made us so that the essence of health is simple and easy to follow for all. But it does take a little work to sort through the evidence, but now we have a clear picture, don't we?
That's right.
The omega-3s are absolutely essential. Supplementing pays dividends, and it leads to the life that God wants for us, the healthy, abundant life. Thank you so much for your kind attention. We'll see you tomorrow, folks.
Thanks, everyone. We'll see you tomorrow right here on Your Health. Bye-bye.
In the pit of my stomach, I knew it was going to be positive. I wouldn't be in this situation I wouldn't have even been taking it if I didn't think it was going to be positive, but I didn't want to admit that. I turned it over, and there were 2 lines. It was a positive test. I remember just being like, oh no. Like, that was all that really went through my head. I I didn't know what to do.
Hear the stories and experience the freedom on real life.
This week on Our Jewish Roots, we begin our examination of the kings of ancient Israel and Judah in our series,